I just privated all of the videos on my channel, and that's because I am applying to medical school. So there you go. There's an update. I just wanted to kind of give an update because I know that there's still a lot of people who are subscribed to me, and I personally would be curious if someone just disappeared, kind of what's happening with them. So I am in my 5th year teaching. Currently, I'm teaching in a teacher on special assignment role, but I'm still teaching elementary school full time, and I'm also a rock climbing coach. So I guess I like to say climbing coach, not rock climbing coach, because we're at a gym and we only touch plastic, you know? Anyway, whatever, boulder things. So that's like my main sport is rock climbing. So for 2 years, I did Teach for America, and I taught at a charter school, and I decided to leave the charter school for lots of reasons. And then when I started at the end of that year, I developed this really severe back pain, and I wanted to continue in a career as a teacher. I really enjoyed teaching. I found it really rewarding, and I thought still, many years in the future, I would apply to med school. But then at the end of my 2nd year, I got this really bad back pain, and I started to pursue like medical interventions for it. Of course, it moves really slow. We start with conservative treatment, and then when I started to develop neurological symptoms, specifically, I was starting to have difficulty walking, and I had numbness and pain in my knee. Then they sent me for an MRI. And at the very beginning, actually, like a couple weeks before the first day of school at my new job, my first teaching job that wasn't at the charter school, I had an MRI, and I was fully convinced it was just going to be a herniated disc. And then it turned out to be this. Okay, do you see that? So that is a spinal bone tumor, and let me show you the CT for it. It didn't show up on x-ray at all, but here's the side view of my spine. The CT, as you can see, the bone tumor ate away half of my L2 vertebra, and so it made it, there's another view, it made it pretty much impossible for me to climb. I'll show you my fancy MRI. That's what it looked like if you like slice me like a ham. That's what it looked like, okay? And you can see how it's smushing this muscle. That's the psoas muscle. So I had this aggressive, inflammatory, destructive spinal bone tumor, and they thought it was benign, but there was still cancer in the differential. And because it's so rare, my doctor, he'd never treated it. Nobody in that he could find at Stanford, at UCSF, had experience treating these tumors in the spine. And so I'm talking like the estimated incidence is, or prevalence is, about 1 in a million, 1 in 100,000 to 1 in a million. In the spine, it's about a tenth of that. So 10% of them happen in the spine, and then only 20% of them happen in adults. So to happen in an adult, we're talking less than 1 in a million. So adult physicians who treat adults are substantially like unlikely to have encountered this tumor in the spine before. And so because spine surgery is already a subspecialty, finding care for specifically a spine tumor can be really challenging. So anyway, he sent me to the Mayo Clinic, to somebody who's double board certified in oncology and orthopedic spine surgery. And that's where I got this fancier MRI, and that's where they got a biopsy, and I was ultimately diagnosed with a benign tumor called an aneurysmal bone cyst. But they are very aggressive, so they don't metastasize, they're not cancer, but they are very aggressive. And so that's why it dissolved half of my L2 and turned it basically into like bloody mush with these little eggshell bone things. They call it soap bubble appearance, if you can imagine that. So the bone is like the outside of the bubble, and the inside of the bubble is blood, and a lot of pressure builds up. It caused a lot of pain. So by the first day of school, I went to the ER after the first day of school that year. This was August of 2022. And I was in severe pain, like 7 out of 10 all day, all night, even though I woke up on the hour every 3 hours to take ibuprofen or Tylenol. And even when they eventually prescribed me narcotics, I was unable to sleep through the night still. So it was really, really severe. And like I said, it affected my walking. So I was unable to walk more than 10 feet without like everything on my right side cramping up, because one of my nerves was being severely compressed. And so the muscles in my legs just weren't coordinating right. When I went to the Mayo Clinic, which that's where my doctor referred me, I just couldn't walk at all. So I had to get wheelchair assistance, going through the flying process. And my parents, fortunately, were able to fly in and wheel me around everywhere. And I was like fangirling when I went to the Mayo Clinic. But in that whole process, I was the one who basically figured out my treatment. So my doctors wanted to do surgery, including my doctor at the Mayo Clinic, which who am I to question him, okay? But I read all of the research, and when you have like an extremely rare condition and you know that your doctors have not heard of it, it is sometimes frustrating when I bring up treatments that are mentioned in the literature. Like if you look this up, if you look at it on Medscape, then these are treatments that are mentioned, but the doctors don't seem to be aware of them. It can be a little bit frustrating. So I kept trying to bring up this non-surgical treatment, which is doxycycline sclerotherapy, because surgery has a really high recurrence rate for this particular tumor, but they weren't biting. And then I had already elected a different insurance back when I thought I just had a little bit of back pain, which is Kaiser. And so if you know anything about Kaiser, it's an HMO where you can only see doctors that are under the Kaiser name at Kaiser facilities. And so I was unable to continue with my doctors at Mayo Clinic. I kind of had to start over with Kaiser. Kaiser still recommended surgery. And after my biopsy, it actually relieved some of the pressure in the tumor and induced some spontaneous healing. And so I was feeling a lot more mobile. I was feeling a lot like more able to cope with the pain throughout the day. With medication, it was probably about a 4 or a 5 throughout the day, which is a lot easier. And when you're working with kids, it kind of like distracts you from your pain, if that makes sense. Like I was still exhausted at the end of the day every day, but it was much more manageable and it made me more patient. And so having read all of this literature about it, I knew that the treatment that I thought was actually the best first line treatment for me was doxycycline sclerotherapy, which is an interventional radiology treatment. Interventional radiology, it's a specialty that kind of like treats a lot of different things, but basically in this case they put me under CT and then they insert a needle and they inject this substance, which is called doxycycline, which is primarily known as an antibiotic, but it's also a sclerosant, which means that when you inject it into soft tissue, particularly vascular tissue, so blood vessels and lymphatic tissue, then it makes it sclerose, or it makes it turn like hard, basically. And so they use it to, when kids have like lymphatic malformations, meaning that their lymphatic vessels, something's wrong with them, then they inject doxycycline into it and it makes all of it harden up and it fixes those problems, because it basically takes them away. And so the thought is that because this tumor is like, it dissolves the bone and it's filled with blood, that it is a tumor of the lymphatic component of the bone. And so injecting doxycycline in it, not only it acts as an antibiotic, it stimulates growth of the cortical bone to heal up the tumor, but it also scleroses all of this, the vascular component of the bone in the area of the tumor, which kind of stops the growth of the tumor. And it has a lower recurrence rate, but overall, I wanted to preserve my mobility, because L2 is a really critical vertebra for mobility. All of your loaded bending and twisting happens in your lower back, and you only have 5 discs. In my case I have 6 because I have an extra lumbar vertebra, but if they have to fuse 3 of those, and that like dramatically increases the chance of in the future needing other fusions, because you develop like really bad really bad arthritis in those joints. And I just didn't want to sacrifice any mobility if I didn't have to. Like I probably will have, increased risk of more arthritic symptoms in the future. But I was able to get the doxycycline sclerotherapy, and this is what I did. So there was one surgeon who was listed as a first author or an author on a lot of the papers that I had read about doxycycline sclerotherapy in the spine. And to me, it seemed like he was one of the big advocates for not doing surgery as a first-line treatment for this particular type of tumor. Now, doxycycline sclerotherapy is unique to aneurysmal bone cysts. Other spinal bone tumors, this is not a treatment that works for them. But basically, this doctor, throughout his practice, he was one of the pioneers of oncologic spine surgery. So he was one of the first people to invent and develop the protocol that they now use to do spine surgery, spine surgery on tumors, to resect them, to take them out. And so he's a spine surgeon. And he developed his niche as spine tumor surgery. And being a surgeon, it's very like the tendency is to see this tumor and say, okay, we're going to take it out. But you can't really do oncologically valid surgery means you are taking cutting only through healthy tissue, and you're basically like encapsulating the tumor. So if this is the tumor, I'm going to cut a margin around it. And the wider the margin that you leave, the less likely the chances that the cancer will come back. So if somebody has a cancer that hasn't spread, basically for a lot of types of cancer, the only cure is to cut it out as one piece. If you violate the tumor, meaning you cut accidentally through the tumor, those cells can spill out and cause the cancer to metastasize or allow it to just stay there and eventually come back. So you want to cut a margin. The problem is when you have a spine tumor, then if it's in the bone, it's probably really close to some critical structures. Now, they can't cut out a chunk of my spinal cord, right? They could if this was a life-threatening condition. It's not, so we can't treat it like that. And even if it was, I'm not sure if they do that. Even if it was a life-threatening condition, maybe they do. I don't know. But so you can't just cut out wildly and you can't get this nice margin in spine tumor surgery. So, and it's very delicate. You want to preserve mobility, preserve the spinal cord. Sometimes they do end up cutting nerves when a person needs a surgery for a cancer. I don't know that they cut the entire spinal cord, but they do end up cutting nerves. And so anyway, there's this delicate balance between actually having surgery that could be curative of a primary spinal bone tumor and preserving those essential structures. And so this doctor, his name's Dr. Boriani, he's an Italian surgeon who kind of was one of the three main surgeons involved in developing the staging protocol for how do you figure out how much do you need to cut and how stable is the spine, like how urgently is surgery necessary. And he believes, based on his practice where he's treated over 50 aneurysmal bone systems of the spine in his institution, he's kind of, from my reading, the surgeon with the most experience treating these types of tumors in the spine, and like in the world, he's the expert. And his belief is that it is not a good idea. In his words, he told me, borderline malpractice to do surgery on these types of tumors, because if the spine is not at immediate risk for fracture, treating it by taking out the entire vertebra, like they were proposing to do for me, is way too aggressive for something that's non-life threatening. When you can try a conservative treatment or even just watch and see if it heals on its own, is always going to be a better option, because this is a really risky surgery. It's very close to the aorta, the abdominal aorta, and you're introducing a whole host of risk, plus having this permanent fixation of the spine, future deficits, all those things are concerns. So, and there's a high recurrence rate. So imagine I went through this also spinal fusion is like one of the most painful surgeries. So imagine, and it was supposed to be a 2-stage, both 12-hour surgery, imagine going through that recovery and then 30% chance the tumor comes back. It's brutal. So I kind of reached like the end of the road with the Kaiser doctors. Like they said, they'd already talked to oncology. They didn't really want to like investigate this idea of doxycycline sclerotherapy further. And so I reached out I found Dr. Boriani's institution on this medical tourism website for Europeans, because he works at a private hospital. And I messaged them and I asked them if I would be able to see Dr. Boriani to speak with him directly. And they said, yes, it would be 300 euros. And so I paid the 300 euros because I was already at like a crossroads, right? And so at like super early in the morning, I think it was like the middle of the night, but it was 9 a.m. for him. I think it was 12 p.m. for me. Then I got on or maybe it was 5 a.m. I don't know. It was, I remember it was really late at night. And I got on a call and I was like pretty much fangirling. I was like, oh my God, I remember Dr. Boriani, when he saw my cat, he like freaked out. He has a cat too. But he was very technical in his explanation, and when he told me those words, surgery would be borderline malpractice, it meant so much to me. And he wrote me a treatment plan for doxycycline sclerotherapy that I could go take back and I could show to my doctors. And when I showed it to my doctor, his name is like on this protocol that spine tumor surgeons use. So any spine tumor surgeon would recognize his name. And so my doctor referred me to orthopedic oncology, and I was scheduled in January of 2023 for my doxycycline sclerotherapy. In March of 2023, I decided that I felt good enough to go back to climbing. In March of 2022 is when I had to stop climbing because it was too painful. So I spent an entire year off of climbing, and I am happy to say after 13 sessions, I was able to do 13. oh, I thought I just showed a 4. 13 sessions back, I was able to do my first pull-up again because I had lost all my strength to do pull-ups. And I just got my first V5 like last week, Sunday, I just got my first V5. And so I'm climbing at the highest level that I've ever climbed. There is not really any advice to say like necessarily that it's safe for me to go back to climbing, but now I've been doing it for a year. And so I feel really comfortable. I'm keeping up with my regular like maintenance MRIs, and we have only seen evidence that the tumor is like slowly healing. I elected to only do 1 doxycycline sclerotherapy because I think as long as I am slowly building cortical bone and I'm not having symptoms otherwise, which by the way, I'm completely symptom free. I have no pain. I went through physical therapy and to help correct like one of my muscles atrophied as a result of the nerve compression, but I have no pain doing anything. I actually, there's like, if I can move in a specific way and then I can feel how the bone healed kind of misshapen and it's overhanging. Let me see if I can find a picture of the misshapen bone. Oh, here we go. So the bone is kind of overhanging. Do you see there? And that can like hit the nerve if I like move in one very particular way that's not natural. And so I avoid that, but otherwise I have no pain. I used to get aggravations when I walked a long distance, but physical therapy resolved that. I'm completely off of pain medication. I don't need to take any other medication for the condition. We only are monitoring it with MRI, and as long as it doesn't come back, I'm not going to do any sclerotherapies. If it does come back, I'll do another sclerotherapy. And so this whole situation is like pretty much under control. But if you can tell by the way that I'm talking about it, I find these topics to be like deeply fascinating. I just being in such close proximity to the medical system, it made me feel like that was something that's missing from my life. And I find my career as a teacher very rewarding, but particularly I like the parts where I'm able to really connect with my students and be there for them during the most difficult moments. I like collaborating with my colleagues to solve or figure out how to support students in these almost impossible situations, right? And I think I can get that kind of reward combined with the domain of information that is the most interesting to me out of medicine. And so it just really felt like also this process of, potentially losing my mobility and kind of having to confront my mortality with cancer being in the differential, that whole process made me feel like it was time. And so that year I started taking more advanced bio classes in Berkeley Extension, and I took biochemistry to kind of feel it out and do my last prereqs. And then in the spring of this year, I took my MCAT, and I scored well enough to where it really only makes sense for me to apply MD this cycle. I did make a critical error on my application, which is I mentioned that my experience with mental illness, and I have been in remission from bipolar disorder for the last 6 years. I continue to take my medication and do like all of my maintenance things to keep up my mental health, but I have been through some difficult things, like not even including the spine tumor situation, that have made me feel really confident in the fact that I'm in remission. And I think I have a lot more tools to support my mental health now compared to when I was an undergraduate and I first experienced symptoms. But I have been in remission for 6 years, and I personally don't feel any stigma or shame around talking about mental illness. And so it just didn't occur to me, nor anyone, I guess, who reviewed my application, that this is something that could be a red flag for med schools. But later on, I was reading about applications, just happened to come across the fact that you're not supposed to talk about mental illness on your med school application. So I don't know how this cycle is going to go. It's really hard to apply to med school anyway. I just, wish the best of luck to anybody who's applying, and we'll see where things go. If I don't get in the cycle and I kind of feel that it's because of the red flag on my application of having mentioned a history of mental illness, then I will probably apply DO in a future cycle, probably not next year, but the year after. But I don't know, wish me luck. I applied to 38 schools, so been a lot of work, but hopefully I get in this cycle. If not, I'll continue teaching, which is rewarding anyway. But I'll continue teaching until I can actually get into medicine, which is what I want to do. So I hope things are going well with you. I just wanted to give you a little update, and I wanted to tell you my story of my weird spinal bone tumor, because weird things happen in life, and we work through them and we survive through them. And I think if there's anything that I have learned over the last several years since I have graduated college is that you learn the most from the experiences that you actually authentically are present in, right? That putting yourself in difficult situations and learning how to lean on other people, and learn from them about how to deal with those situations is something that expands your ability to deal with difficult situations. And being able to step into those situations can really give you confidence as a person. It can make you feel more prepared to have a meaningful impact, to connect with people meaningfully. And I feel in general just that I have matured a lot, and I'm less trying to figure out what has wronged me in the world, and more so trying to mend things that may be deficits, for me or for the people around me, and to become a better person, to become a better partner, better teacher, and better friend. And I tend to think about things more in terms of like, how can I solve this problem? I feel like I am more authentic and earnest compared to what I was as an undergraduate, but I attribute a lot of that to having just a genuine experience of having to be responsible for something where you can't escape the reality of where you are. Being a teacher, being in front of kids, you can't keep up a certain facade. Like, you will be tested in the moment, mentally, emotionally, and you have to show up as a whole person. And if you do that inauthentically, it's just not going to work. You're going to burn out, or the kids are going to see through it, but either way it's not going to work. And you have to learn to become aligned with your personal integrity and show up as a whole person, both emotionally and intellectually. And when there are problems, you have to think about solving them. You can't just sit and think about how bad the problem is, if that makes sense. And I think in that way, teaching has really made me grow and made me feel prepared to move on to a career in medicine in the future. I am not in a rush to get there, because I want to do that path justice. I want to be a good doctor. I see this as a future for myself. And I know that there's a lot that I can still contribute as a teacher, but I want to be a doctor, and we're on the path to that. All right, I'm rambling right now. I'm going to say bye. I don't want to edit this video, so goodbye.